Basic Radiology for 7th semester medical students. The Basic Radiology course in the 7th semester is designed to provide a fundamental understanding of medical imaging and disease diagnosis. Students learn the principles of physics, imaging techniques, radiological image interpretation, indications, contraindications, and the role of radiology in patient management. The primary focus is on using radiology as a diagnostic tool, recognizing pathologies through images, and applying radiology in various medical fields. 1. Basic principles of radiology. A. Imaging physics. 1. X-rays, electromagnetic radiation used to produce images of internal body structures. Process. X-rays are absorbed by tissues. Right-pointing arrow images are generated based on tissue density. Bone appears white, air appears black. 2. Ultrasound, US, utilizes high-frequency sound waves. Advantages. Non-ionizing radiation, safe for pregnant women. 3. CT scan, computed tomography, combines X-rays and computer processing to generate detailed cross-sectional images of the body. 4. MRI, magnetic resonance imaging, employs strong magnetic fields and radio waves to produce soft tissue images. 5. Interventional radiology, diagnostic and therapeutic procedures guided by imaging, e.g., angiography, biopsy. B. Key terminologies in radiology. 1. Opacity. White areas on X-ray images due to increased density, e.g., bone. Fluid. 2. Radiolucent. Black areas due to decreased density, e.g., air in the lungs. 3. Contrast agents. Substances used to highlight specific structures, e.g., barium for the gastrointestinal tract, iodine for blood vessels. 4. Artifacts. Distortions on images unrelated to actual body structures. 2. Radiology examination techniques. A X-ray examination. 1. Procedure. Patient positioned in front of the X-ray source. Images taken in various projections, anteroposterior, lateral, oblique. 2. Applications, bone assessment, fractures, osteoarthritis. Lung disease diagnosis, pneumonia, pleural effusion. B. Ultrasound, US 1. Procedure, sound waves emitted through a transducer. Reflections create organ images. 2. Applications. Pregnancy evaluation. Detecting kidney stones, liver enlargement, or tumors. C. CT scan. 1. Procedure. Patient placed inside a circular scanner. X-rays projected at multiple angles to create 3D images. 2. Applications. Head injuries, hematoma, brain edema. Tumor or metastasis detection. D. MRI. 1. Procedure. Patient positioned inside a large magnetic scanner. Radio waves generate high-detail images. 2. Applications. Diagnosing soft tissue injuries, ligaments, brain, spinal cord, brain or nerve tumors. E. Interventional radiology. 1. Procedure. Minimally invasive diagnostic or therapeutic techniques, e.g., stent placement, biopsy. 2. Applications. Angiography, visualizing blood vessels. Embolization to stop bleeding. 3. Pathologies studied. Students are taught to recognize various pathologies through radiological images, including a musculoskeletal system. 1. Fractures. Visible as lines of bone breakage. Types. Transverse, spiral, comminuted. 2. Osteoarthritis. Joint space narrowing and osteophytes. 3. Osteomyelitis, bone density changes due to infection. B. Respiratory system. 1. Pneumonia, opacity in lung fields. 2. Pleural effusion, fluid accumulation with an air fluid line. 3. Pneumothorax, loss of vascular pattern in lung fields. C. Cardiovascular system. 1. Cardiomegaly, enlarged cardiac silhouette on chest X-ray. 2. Pulmonary embolism, thrombus visualization on angiography. D. Digestive system. 1. Bowel obstruction, dilated loops of intestine with air fluid levels. 2. Bowel perforation, free air under the diaphragm. E. Urogenital system. 1. Kidney stones, radio-opaque appearance in the urinary tract. 2. Hydronephrosis, dilated renal pelvis. 4. Clinical aspects of radiology. Indications for radiology: physical trauma, fractures, head injuries. Respiratory diseases, infections, lung tumors. Abdominal pain evaluation, appendicitis, gallstones. Tumor and metastasis detection. B. Contraindications for radiology. Pregnancy, especially for X-rays and CT scans. Allergies to contrast agents, iodine. Claustrophobia, for MRI. 5. Radiological image interpretation. Students learn to 1. Assess image quality, patient positioning, X-ray exposure, and artifacts. 2. Recognize normal patterns, lung patterns, bone shapes, organ sizes. 3. Detect abnormalities, masses, fractures, fluid collections or obstructions. 6. Practical training and simulation. A. Hands-on training, reading basic radiological images, chest X-rays, extremities. Discussing clinical cases based on images, e.g., pneumonia, bone fractures. B. Case studies. Interpreting X-rays for chest trauma patients. Identifying brain tumors on MRI. Evaluating bowel obstructions with CT scans. 7. Competency development. By the end of the course, 7th semester students are expected to 1. Understand the basics of imaging techniques. 2. Interpret simple radiological images. 3. Select appropriate imaging modalities for specific clinical cases. 4. Communicate effectively with radiologists for consultations.